Welcome, everyone. Today we are going to talk about the data submission process for the Diabetes Prevention Recognition Program, or DPRP. We will focus on the revisions that were made to the DPRP Standards, the National Diabetes Prevention Program, National DPP Registry of all recognized organizations, and the DPRP Data Portal with respect to administration, data submission, and data collection. We will also present the participant enrollment form. As part of the 2024 DPRP standards, we have updated many of the functions in the DPRP Data Administration and Submission Portal, also referred to as the DPRP Portal or the DPRP Data Portal. During this section of the webinar, we are going to talk about updates that were made as of August 1st, 2024. The DPRP Registry is the National Registry of Recognized Diabetes Prevention Programs, which lists publicly available information, like contact information, for all CDC-recognized organizations. The DPRP Registry has undergone an expansion. We are now including the organization's address and email, which comes from the data you have provided in the DPRP Data Portal under the Organization Profile section. As a reminder, to access the DPRP Data Portal, log in using your Secure Access Management Services, or SAMS, credentials. Whether you are the program coordinator, the secondary contact, or the data preparer, if you are having any challenges updating the information yourself, you can provide us with the information by submitting a request on the National DPP Customer Service Center, or CSC. The green button on the right will take you to the CSC where you can ask for help. On this slide, we have highlighted the changes made, so that when you see the registry, you will be familiar with the information you need to provide. We also want our organizations to be aware of what is in our system, so you are ready and comfortable to make updates. We will walk through this together. The address field has been adjusted to make sure that it is front and center for other organizations or prospective participants to see clearly. Additionally, as you continue to navigate to the right, we are now providing the organization's email. This could be a shared or general email box so that others, including prospective participants, can contact your organization. As you continue to move right to the third red box, if an organization has multiple org codes, all of the delivery modes the organization offers will show here. Another organization or prospective participant could see this and toggle to any of the available types of classes that organizations offer. Then, the fourth box that you see here shows who can participate in the program. In this example, the program is open to the public. As we continue to talk about the changes implemented with the 2024 DPRP standards, there will be a need for organizations to update their information within the DPRP Data Portal. The next few slides will cover these updates. In the DPRP Data Portal, changes have been made under the organization's profile in the Class Location tab. Now, we will walk through each of these changes. We are going to review what a mock-up of these changes will look like so that you understand the expectations of the contacts for your organization as of August 1st, 2024. CDC will require that all organizations update and/or confirm the organization's profile information prior to making each data submission. You may be asked to attest to your delivery modality in each contact you have listed for your organization. You will also have the option to add additional information about your program attributes underneath the class locator. We have bulleted the 3 new changes that you will see as you open your organization's profile. Attesting to the delivery mode, updating the contact titles, and expanding on any class of information details. Again, CDC is going to require that all organizations update and/or confirm their organization profile. Here we see the new delivery mode attestation. By confirming, you are letting us know that you understand Section 1 in the 2024 DPRP standards, the guidelines for session delivery, and you are agreeing that your organization will deliver the sessions as defined within that approved delivery modality. You will complete this attestation by clicking the checkbox and pressing Save. Here you can see how the program delivery page will appear after you complete the delivery attestation. Please review the information, and if needed, you may edit any or all of the information by clicking Edit All. If these items are accurate, then you can make the overall attestation or confirmation for the entire page. As a reminder, these attestations are important. We need the most accurate information for your organization, not only to be displayed on the DPRP registry or on our Find a Lifestyle Change program tool, but also because CDC may contact your organization with information that pertains to your recognition. There have been changes to the contact section. In this section, each contact will now be able to select from a drop-down menu of titles. These titles were gathered from the most common ones that were input into our DPRP data system. If you do not see your title listed, you will be able to select Other with an option for a free text box in which you can provide us with a custom title. This update will be required for the program coordinator, the secondary contact, the data preparer, and the umbrella contact if applicable. As a reminder, all three contacts, the program coordinator, secondary contact, and data preparer, have permissions to submit data to CDC every 6 months for your organization. Only those listed as an authorized contact here will have access to the DPRP Data Portal. Additionally, the program coordinator is the only required contact. Your organization may not have someone listed for the other contact roles, and that is okay. Once information has been provided or updated for each of these roles, then you will make an attestation under each, stating that this person is your assigned contact and that the email address is valid. Once the checkboxes for each contact have been selected, you will be able to attest and confirm that the information on the entire page is up to date. Lastly, for our administrative updates, we have expanded the option for you to provide additional content on your class information, specifically the payment options. You will be able to multi-select any of the options that are applicable. We want to note that the options have been expanded based on what we heard from our organizations, and we want this information to be available for any prospective participants who would like to learn more about your program. Next, we will go over the changes made to required data elements. We have added new variables and have revised others, either in name or available response options. The first new variable is participant zip code. Due to the growing participant enrollment, the location of the organization headquarters is often not the location of the participant. It is important that we know where participants reside in order to identify areas lacking lifestyle change program access. This new variable is required for all participants and there is no default option. The second new variable is for participants who identify as Middle Eastern or North African. The coding options for this MENA variable is the same as other race variables, a 1 or a 2. The next new variable is ethrace info. This is a free text response item up to 100 characters and allows the participant to provide more details about themselves as it pertains to ethnicity, race, country of origin, culture, ancestry, or etc. This data element will not be validated for spelling or grammar, so please enter the information exactly as it is provided by the participant. If a participant declines to add the information, please enter NA, did not reply, or a similar indicator. Please do not leave the entry blank. We have added a 6-point disability question in an effort to determine if and where there are gaps in enrollment, and or to make any needed program changes. This particular question consists of a series of 6 different data elements, each with the same 3 options. The participant has a disability, does not have the disability, or no response. If the participant chooses not to respond, please enter the default value 9. The variable previously named ethnic has been renamed to Hispanic. The response options Hispanic or Latino or not Hispanic or Latino are still available. However, in an effort to align this data element with the other race variables, we have removed the not reported option. For the variable that represents Native Hawaiian or other Pacific Islanders, we have changed the name from NHOPI to NHPI. The response options are unchanged. For the existing payer source variable, we have removed the option of Other and have included 2 additional options to exhaust all of the possibilities. Also, as a reminder, 999 is no longer a default option for PA. Going forward, organizations will not be able to submit a file with this entry for PA. If a participant reports performing exactly 999 minutes of physical activity, please enter 1000. In an effort to simplify collecting enrollment data from participants, we have created an optional data collection participant enrollment form. The participant enrollment form is located in Appendix D of the 2024 DPRP Standards. Use of the form itself is optional when collecting participant enrollment data, but the individual questions themselves are not. If you choose to use the form, please do not send it to CDC. Instead, use the participant responses to populate the corresponding columns in the CSV. Enrollment information needs to be collected only once, but may be updated if the information changes. Here is a quick look at the form. It includes questions about race and ethnicity, demographics, education, disability, enrollment motivation, payer source, and more. Again, the information in the participant enrollment form should be used to populate the CSV data elements. Here is guidance for how to translate the responses to the CSV. For the question, what is your race or ethnicity? Select all that apply. A participant may choose one or more options. For example, one option is American Indian or Alaska Native, with some examples of who this might include. At the end of the question, it says you can provide additional details below. A participant may enter Navajo Nation, a Blackfeet tribe, or any details they wish to provide regarding how they identify. If the participant does not check the box for American Indian or Alaska Native, then on the CSV you would enter a 2 for AIAN. If the participant does check the box, you would enter a 1 for AIAN on the CSV. This would be true for each subsequent response option. For each race variable, American Indian or Alaska Native, Asian or Asian American, Black or African American, and so on, participants will have an opportunity to provide additional details. But how do those entries translate to the CSV? Any information provided can simply be copied and pasted into the spreadsheet in the ethrace info column. There is no need to attempt to correct typos or misspelled words. The character limit is 100, but if the response is longer than that, you may still paste the full text, knowing that only the first 100 characters will be accepted. If a participant leaves the additional details portion blank, you would still need to enter something for ethrace info. As usual, a blank cell will cause an upload failure. You can enter NA, didn't answer, or something similar. Height is also collected on the participant enrollment form. On the form, it asks for height in feet and inches, but that will need to be translated into inches on the CSV. This is a snippet of the disability questions with response options of yes or no. Are you deaf or do you have serious difficulty hearing? Yes or no. If the participant does not check either box, please enter the default value of 9. Again, a 1 is yes, a 2 is no, and a 9 is chose not to respond. Please note, a participant may always choose not to provide a response, but organizations are required to ask the question. The default should not be used in lieu of attempting to collect the information. Now we're going to talk about what has changed and what has not changed in the data reporting process. What has remained unchanged? Administrative tasks and all data submissions will still be completed within the SAMS portal. Organization profile information must still be reviewed, updated if needed, and confirmed every 6 months. All data must be prepared and submitted in a CSV file. Data submissions are still due every 6 months based on the organization's effective date. So what are some things that have changed? As previously mentioned, confirming contacts every 6 months will now require an additional attestation. For each program coordinator, secondary contact if applicable, and data preparer if applicable, organizations will need to check a box next to the person's information prior to clicking confirm. It is critical that an organization's contacts are always up to date, as most or all communication and announcements are sent via email. Failure to do so could result in an organization missing vital information and even risk losing recognition because of non-response. Also, as a reminder, organizations do not need to wait until their data submission month to update contact information. While organizations are required to review and confirm during their data submission month, updates can be made at any time. As with previous DPRP standards updates, CSV files must be in 2024 format in order to submit for validation and review. Another change that may be helpful for those who have trouble resolving errors flagged by the automatic validation system. Previously, CDC did not have access to a CSV file until it had been fully submitted, meaning all errors and required confirmations had to be cleared. In the updated portal, as long as a CSV file uploads correctly, we will be able to see the data profiler, download the file, and check the validation details. We will not have the ability to make edits to the file or push it through to submission, but it will allow us to assist in troubleshooting. If needed, we will also still have the ability to manually enable the Submit to CDC button. These next changes pertain to upload failures and will hopefully simplify the upload process. Incorrect 2-year date format, for example 24 instead of 2024, will no longer cause an upload failure, but will now trigger a hard stop validation error in the portal. Please note that errors or typos in date entries can trigger a cascade of other issues. If the portal flags date entries as errors, we strongly recommend reviewing those first. Most extraneous markings or notes outside of the main body of data will be ignored and no longer trigger an upload failure. However, organizations will want to make sure that the total number of records matches what is expected, because if there are rows that have, for example, just one org code entered, the system will truncate those records. If those were meant to be full rows of data, but were mostly left blank, they will not show up in the portal. An incorrect org code or a blank cell will still cause an upload failure. However, instead of giving a list of items that could be causing the upload failure, the portal will now give row and column specifics of where the issue is found. For example, the warning may indicate that there is a missing entry in row 3, column 2. This corresponds to the cell in the third row of column 2. Navigate to that cell in your spreadsheet and make the update and then attempt to re-upload. We know that submitting a file every 6 months with mostly the same data for enrollment information can be a little bit tedious, so we've attempted to make things easier. We now offer an option to upload a file in 2 parts. Previously, you were required to upload all records and data elements in a single CSV file. This new option will allow you to upload a CSV file with only participant enrollment information and then upload another CSV file with just the session level data. The list of data elements in both versions are listed as well. While it sounds a little more complicated because you're uploading 2 files instead of 1, it becomes easier 6 months later when you're preparing to upload and submit additional records for those participants. If you have no new participants, you will not have to upload the enrollment file again. You will only have to upload the session level CSV file because the enrollment data will already be there. It's less data that you have to track and copy and paste for sessions. As a reminder, this 2-file upload method is optional. You will continue to have the ability to upload all data elements in a single file. Also, please be aware, the 2-file option and the combined single file option refer to uploading data only. Once the file or files are uploaded, the editing and submission process will be the same regardless of upload method. As a reminder, uploading a file is not the same as submitting. If the status of the file is validated, then it has not yet been submitted to CDC. To move forward with the submission, you will need to click on Data Profiler. There is a change in how organizations access data that needs to be edited or updated within the portal. In the past, if issues were found in a participant's records, then on the Edit Records page, there would be a single screen for each participant that displayed all records for that participant. You would identify the pink or yellow cell that needed to be addressed. Now, the records have been divided into two different screens, Session Data and Participant Data. The view will always default to the Session Data tab, but errors, required confirmations, and quality checks can appear on either or both tabs. The title of the tab will appear in red font if there are issues on that tab. Please be sure to review and make corrections on both tabs as needed. When all issues are resolved and the Submit to CDC button is green and active, clicking on it will open this pop-up. Here, there is still a single checkbox that must be marked before clicking Submit. The difference is the updated language associated with the attestation. There are two distinct items you are attesting to, and the one checkbox covers both. Anytime an organization submits a file, they are confirming that they did not use any personal identifiable information for participant ID, coach ID, cohort ID, or any other variable. This includes initials, names, either full or partial, birth dates, medical record numbers, social security numbers, or anything that could identify that participant. The DPRP does not collect and cannot store this type of information in our system. Please be sure to exclude it from all submissions. We have also separated out the confirmation that an organization has gone through and reviewed all quality checks where applicable. Previously, CDC performed additional review of quality checks and would often follow up with organizations to get confirmation. This cannot be guaranteed in the future. Organizations have the responsibility to ensure data entries are correct. For additional questions and guidance related directly to data submission, please contact the data team at dprpdata@cdc.gov. For questions about delivery mode, recognition status, curriculum, coaching, or anything else, please go to the National DPP Customer Service Center and open a case. They will get your question routed to the correct subject matter expert. If you have not done so already, you will need to register with the Customer Service Center before submitting a case. Finally, if your account gets locked or you have trouble with your password, you can contact the SAMS Help Desk directly. This concludes the webinar. Thank you for viewing. As a reminder, please visit the National DPP Customer Service Center for more resources or to submit any questions.